time. We talk about recommending all of these different tests and things like that. Go into your providers, having these tests done when you start to, just notice different changes in your life. And so you may have a lot of questions. You may be wondering what to expect from some of these cognitive tests. And so today's presentation is put together by our adult geriatric neuropsychology postdoctoral intern. JoshFox-Fuller is here with us, and he's going to talk to us about what you can expect when you've been scheduled for one of these evaluations, which is so good, especially if you have had that little bit of hesitation. He is a doctoral candidate in clinical psychology at Boston University and earned his bachelor's degree in psychology and Spanish at Texas A&M. And so I'm really excited. And before we get into that, I also have another guest we're really excited about, Toma, who has been working with us for years with our Google Home study. These devices, smart home devices you can bring in your home to make things accessible at home. And so Toma is going to give a little pitch about some of the recruitments that we've got going on, offer some information about her home study and how you can bring some of these technologies into your home. So I'm going to pass it off before we get started to Toma. It's really good to have you here. Great to see you, Toma.
Thank you so much for having me. Always a pleasure to talk to the Cognitive Empowerment Program audience. It's been a real pleasure working with the Cognitive Empowerment Program over the last several years. And today I just want to share briefly an opportunity for a research study that previously has only been available to active members and care partners who are enrolled in the CEP program, but we're actually opening it up to the community thanks to the generous sponsorship of a seed grant provided by the Cognitive Empowerment Program. So I just wanted to share just a couple tidbits about the study, and I'll share a link if you want to learn more information. If you fill out that link, I will connect with you and give you more information. At a high level, it is a project where we're going to give you a conversational agent. So think like Alexa or Siri. This one's called Google Home. So it's a smart speaker with a touch screen. It'll talk to you. When you talk to it, it can play you music, it can set alarms. And the best part is you can control it just by speaking. You don't have to fumble with a tiny screen. So yeah, it's a 10-week project. I'll give you the device. I'll set it up with you. I'll give you a manual that we made thanks to now 2 years of feedback from over 60 participants who have been using the Google Home in their house as part of the Cognitive Empowerment Program. And then you'll also be invited to a weekly learning session with other people who are learning how to use it just alongside you. And we'll be going through that manual together, giving you lots of actionable feedback and tips and tricks on how to make the most of this device. Absolutely no pressure at all. But if you are interested, I just dropped a link to a survey in the chat. And if you just fill that out, I'll reach out to you and we can start talking more about you participating.
That's really exciting. A lot of people have been curious about these like smart home devices, but maybe getting into it is a little bit intimidating. Maybe that prospect of having those weekly sessions and someone to work with you and having those manuals really could open a whole new door to feeling accessible technology in your home and really feeling like you know how to use it, which is the other half of the battle once that technology comes in. So let us give you some technology for free. And let us put some of the ringer that Toma has put the rest of our members and our participants in our program through to really kind of offer these directly to you. So follow the links that are in the chat if you're interested in being a part of the study. If you want to get smart at home, those links are there for you guys to be able to connect directly with Toma, who is, by the way, a dream to work with. So Toma, really good to have you. Good to see you back at CEP.
Thank you so much. Pleasure to be here and have an awesome CEP Live.
Thanks. All right, well, we're going to transfer over to Josh. Josh is going to tell you a little bit about him, about the work that he does, about these evaluations that we talk about so often. So go ahead, Josh. I'm going to pull up your slides for you. Give me a moment to get these pulled up and I'll go ahead and let you take over.
Thanks. Yeah, while you're pulling those up, I just want to say it's a pleasure to be invited to present to all of you today. It's exciting to see 54 plus attendees on the call. I just am really excited to be here. So, I think the beauty of the CEP Live, Cognitive Empowerment Program Live is that we really focus on empowering you throughout, different aspects of your healthcare and cognitive experience. So we will be talking about neuropsychological evaluations today and how you can be empowered to know what they are and how you can be prepared for them. While we're doing that, I just want to say I have some time sort of reserved at the end of the presentation for our for questions and answers. But you can feel free at any point to put any questions you have into the chat box or into the Q&A box, and we'll get to them toward the end. Give me 1 second here. I'm just going to get myself set up a little bit on my side since we're sharing through the screen that way. Okay, so the talk that I'll be giving today is called Neuropsychological Evaluations. What are they and how can I prepare for one? If you can go ahead and advance to the next slide, please, for me, Megan. You can just hit I think there's like 5 buttons here. So we'll be doing a brief introduction to myself because I'm a new face around the Cognitive Empowerment Program. We'll be talking about what is neuropsychology, and I'll explain what a neuropsychological evaluation is and how people can be prepared if they are referred for a neuropsychological evaluation. And then lastly, I think if you hit the forward again, we'll just have some time for Q&A. If you go to the next slide, and the next slide too. So as Megan mentioned, so I'm currently the adult and geriatric neuropsychology predoctoral intern here at the Emory University School of Medicine. There's one other adult and geriatric neuropsych intern named Jasmine, who you might have the pleasure of seeing give a webinar sometime in the spring when she rotates over here and I flip to where she is. So as Megan mentioned, I did my undergrad at Texas A&M University, and then I am in the very end process of completing my PhD in clinical psychology at Boston University. And I just moved here a few months ago to do my predoctoral internship at Emory, where I'm training in neuropsychological assessment. If you go to the next slide. So intern's a funny title. I kind of often say it's sort of like a medical school or medical resident in many ways, because it doesn't necessarily reflect how long I've been involved in the field. There's certainly, people like Dr. Goldstein, who's on this call, and Dr. Vickers, who are my supervisors, who have been, in this area for a long time. But I've been doing Alzheimer's disease and mild cognitive impairment research for almost 10 years. So the far left is me during undergrad, giving a presentation at my first national conference. On the right, I just recently defended my dissertation a few months ago, back in Boston. So I hope to continue to be in this space in the future, and kind of be in the healthcare space, helping to empower people like you as well. So if you go to the next slide, please. So we'll talk about kind of framing the whole talk today. It's important to understand what is neuropsychology. It's a term that often gets sort of, I think, confused with other terms. So if you go to the next slide for me, please, Megan. So we first have the word neuro, which if you think about the base word, it just refers to the brain. And then the next bullet point is psychology, which refers to behavior. So if you hit the next button, so neuropsychology then is just a sub-discipline of clinical psychology and is interested on the relationships between the brain and the behavior. So how do certain issues with our brain manifest in certain behavioral problems in everyday life, like memory and thinking problems, for example. If you go to the next slide, please. So this is kind of a nice visual of that, right? So if there are problems with our brain, how's that manifesting in sort of behavioral issues? Or if we're noticing certain behaviors that are problematic, like forgetting things or changes in our personality, what's the manifestation of that in our brain? Next slide, please. So another important thing to think about is, how does neuropsychology differ from psychiatry and neurology? These professionals, I think, often get kind of mixed up. It doesn't help that neuropsychology and neurology sound very much the same. So if you go to the next slide, please, for me, Megan. There's a couple key differences. So a neuropsychologist, which is what I'm training to be and what Dr. Goldstein and Dr. Vickers are, is a clinical psychologist by training who either got their PhD or PsyD in clinical psychology. Psychiatrists and neurologists, on the other hand, are medical doctors, or you can think of them as physicians. So these people, they went to medical school, whether they got an MD or a doctor of osteopathic medicine, a DO. That's kind of one major difference. It's a different training model, different sort of objectives for what we're training to become. And in terms of the second major difference, it's the scope of practice. So many individuals, you'll actually commonly see, especially if you're having memory or thinking problems, you might see a psychiatrist, a neurologist, and a neuropsychologist as part of your care. The key differences in terms of the scope of practice of what we actually do day to day with patients or people we see in clinic is that neuropsychologists do assessments of cognitive strengths and weaknesses, and they usually do this with a large number of cognitive tests. And we often sometimes will identify and treat psychological disorders with psychotherapy because, again, we're trained as clinical psychologists as well. But some psychiatrists also will do therapy with individuals. Psychiatrists and neurologists, on the other hand, they're the individuals who you see who manage medical conditions. These are the folks who will prescribe you medications. So neuropsychologists don't prescribe medications, but psychiatrists and neurologists might prescribe things like donepezil or Aricept or other medications like sertraline for anxiety. But neuropsychologists won't do that. And some neurologists and psychiatrists may do very brief cognitive evaluations with you. So neuropsychologists will work with you for quite a bit of time when you see them, but you might get a very short cognitive test when you go to your standard psychiatrist or neurology visit. Next slide, please. And yes, as Megan is saying, if you have any questions at any point, feel free to drop it in the chat. If you might be asking a question about something I'm going to say, I might save it to the end, but I'm happy to, if there's things that are coming up, if I'm not being clear during the presentation, you can feel free to just put a question in the chat. So what is a neuropsychological evaluation then? Can you go to the next slide for me? Okay, so I think there's a great acronym, or a great analogy rather, that Dr. Vickers told me about a few weeks ago, which I like. So essentially a neuropsychological evaluation is just testing how a person's brain is working. So you can kind of think of an analogy like doctors, so physicians or neurologists, they're kind of like your car mechanics, right? Where if you have a problem with your car, you might take it into the shop and they might, change the oil or, order up some diagnostic tests to figure out what's going on with your car. So they're really the ones kind of getting in there, tweaking medications, ordering neuroimaging or blood work. Those are what doctors or your physicians do, your medical doctors. Neuropsychologists, on the other hand, I kind of like to think of us like we're the test drivers of the car. So we want to see, how is your brain working if we take it out on the road? Is it rattling or bumpy, or are there certain issues? So we really are kind of more the people of figuring out, when it comes to your behavior and sort of your memory and thinking skills and your emotions, what's going on kind of more functionally. Can you go to the next slide, please? So neuropsychological evaluations test many different aspects of our memory and thinking abilities, or our cognitive abilities, as I'll say. So the first thing that we, when we think about cognitive problems, usually one of the first things that comes to mind is learning and memory. And Donna, I just saw your chat. I have my contact information on the last slide, so you can feel free to shoot me an email if you have any questions. But our cognitive abilities, we often think about learning and memory problems, things that you'll see in, for example, Alzheimer's disease. So I kind of like the analogy of learning something new is kind of like getting some information, putting it in a folder and putting it into a filing cabinet. You're trying to learn it, and trying to store it somewhere, because the memory piece is later recalling or figuring out, how do I retrieve that piece of information and use it? So that's kind of like going back to your filing cabinet later on and trying to remember, what was the information I was looking for? Where do I find it? So some of neuropsychological tests will look at your ability to learn and recall or memorize new information. If you can go to the next slide, please. Other aspects of a neuropsychological evaluation include testing your language abilities. There's many different aspects of language, like the ability to express ourselves clearly and be understood by other people, but also the ability to comprehend what other people are saying. And again, this is kind of different from not being able to hear somebody, but actually being able to physically, listen to what they're saying and make sense out of it. Or also things too with like reading a paragraph or reading a sentence and being able to understand and make sort of sense out of what that means. Next slide. We also will test fine motor skills too. So this can be things like, how's your handwriting doing? How's your ability to tie your shoe or do kind of fine motor things? So in some conditions like Parkinson's disease, for example, people may have motor difficulties that kind of impact different areas like writing or doing fine motor tasks. Next slide. We also will test people's visual spatial skills. So it's not like going to the Department of Motor Vehicles. We're not going to do a parallel parking test exactly with you or anything like that. But we have some tests that look at your ability to kind of understand visual spatial relationships, understand how are objects related to one another in space. So how close or far away are things? This is really important. I think visual spatially, it's important to be able to navigate life safely and understand relationships between objects, like how far things are relative to you and vice versa. So this is another area of skills that we test. The next slide. Another thing we test is a broad term called executive functioning. So if you think about, the way I like to think about executive functioning is sort of thinking about an executive, like a CEO of a company, who is sort of in charge of organizing and telling the brain how to do its different processes. So it's not as simple as like a motor skill, but it's more things like, how do I figure out what to pay attention to, and for how long do I pay attention to that versus all the other competing things in our life that we want to pay attention to. Executive function also includes things like planning. So for example, one thing that some people find challenging many times is following a recipe or going to the grocery store to get ingredients. So how do you make a logical plan to go about following that recipe or going to the store? There's also organizational skills. So how do you not only stay organized in your home, but how do you, for example, approach and organize your approach to doing something new that you haven't done before? Do you just kind of go gung-ho at it, or do you try to take a more methodical approach? And then the executive function also includes things like multitasking. So kind of being able to hold multiple things in our mind at once and switching back and forth between them flexibly versus getting kind of confused in the process of doing that. Next slide. We also, on many of these tests too, we will test sometimes the speed at which you're able to do things. It's called processing speed. And this can be, sometimes we're able to do things accurately, but very slowly. It's a normal thing, for example, in aging, for people to feel like they're doing things more slowly over time. But sometimes it can be really problematic if something that should only take you, 10 seconds is taking you minutes or hours to do. So we look at your processing speed as well during a neuropsychological evaluation. And then next slide. And lastly, we look at your mood and personality too. So some conditions in older adults and even in younger individuals will have sort of will present with sort of alterations or changes in your mood and personality. So one example of this in the sort of neurodegenerative disease space is the behavioral variant of frontotemporal dementia, in which individuals may oftentimes present with sort of personality changes that are very uncharacteristic of them. I'll also note again that a neuropsychologist is a clinical psychologist by training. So we have experience, working with people who have anxiety or depression or other sort of mood disorders. So we want to think about the role that mood disturbance can play in memory and thinking problems. I see a question from Bob in the chat about how important are primary care and other specialist medical providers to dealing with MCI. I'm going to hold that question to the end because I think it's an important question, but I want to just kind of move on with the talk for now. But I see your question, Bob. Next slide, please. Okay, so what can you expect if you're referred for a neuropsychological evaluation or a loved one is referred? Next slide. So first of all, it's important to think about the reason that you were referred for the evaluation. So if you can, that's good. So one reason you might be referred is to clarify sort of diagnostic impressions of maybe your primary care provider or a neurologist or a psychiatrist, because oftentimes you'll see a neuropsychologist commonly after you see your primary care doctor or neurologist to kind of add some more clarity with sort of that test drive of your brain to what's actually going on. If there's some sort of process we should be concerned about. We also want to characterize your current cognitive functioning, because again, a lot of these conditions, things like Alzheimer's disease, for example, they're continuums, right? With many things, we don't necessarily change immediately overnight. Sometimes that happens with strokes, for example, but other things are kind of more gradual. So you want to figure out what's going on cognitively with you now. What are your strengths? what are your weaknesses cognitively, and how can clarifying that help you? And we also want to monitor and understand your functional status over time. So functional status is kind of a word to kind of refer to how are you able to live your life independently. So for example, if you're having a lot of memory problems and are having a lot of close calls while driving, that's important to know because we want to keep you and the public safe, right? Or if you're having issues cooking and leaving burners on, we want to figure out how can we identify that and help you kind of cook more safely or live your life as independently as you can in the context of whatever's going on. So again, we want to monitor and understand that over time. Some individuals, so for example, some people with Parkinson's disease may be candidates for deep brain stimulation. That's a neurosurgical intervention to help with the motor symptoms in Parkinson's disease. There's also, for example, some people with epilepsy will get sort of specialized surgery as well to kind of help control their seizures. So commonly as part of the neurosurgical planning process, you'll be referred for an evaluation to kind of test your cognitive abilities, and you'll be followed over time to see if there's any changes relative to how you were pre-surgically. Next slide. So how long does a typical neuropsychological evaluation last? So I kind of often make the joke with people that I see. I work some with Dr. Goldstein, Dr. Vickers at Emory Brain Health Center, just across the way from where the Cognitive Empowerment Program is. And it's not like your typical appointment with your primary care doctor or your neurologist where you just chat with them for 15 or 30 minutes. So commonly you'll be spending half to sometimes up to a full day with, depending on the sort of the referral question, with the neuropsychologist and their team. I would say typically it's trending more toward the 3 to 4 hours, but it's not abnormal to see an all-day evaluation. Because again, it's like taking your brain on a test drive, right? We're really wanting to see how you're doing across different areas of your thinking and memory skills. So the first part of a common part of a typical neuropsychological evaluation will consist of a clinical interview. And this looks a lot like to a degree, it looks similar to what you might see with a primary care doctor or a neurologist, where the neuropsychologist or the trainee working with them will ask you quite a bit of questions about your current memory and thinking skills, your emotions. And we'll also ask some more detailed questions too about your past, more so things like, what's your educational background? What were you doing for work? Did you have any head injuries, or did your mother have any issues with your pregnancy of you? Things that could, impact sort of your development over time. Because we want to think about how are these cognitive changes or these cognitive problems now related to your overall life history. So that kind of looks more like a typical medical visit, I would say. But then what's different is the cognitive testing that often, again, will last between 2 to 6+ hours. And of course, with plenty of breaks and time to eat lunch or snacks or things like that. And these are the cognitive testing. It's not like a math test or an English test from high school or college. The tests are quite unique and challenging, and that's on purpose because, some of the tests will feel easy for people and some of the tests will feel more difficult. And the whole point is to try to figure out where are your relative areas of cognitive strength and cognitive difficulty, okay? So commonly you use paper and pencil to complete some of these. You might use objects like blocks or other things to do the tests. And some of the tests you'll see will be on the computer as well. I see a question about referral sources for neuropsych. So there are many different referral sources. It kind of depends a little bit on the clinic for how referral sources come in. Typically, I will say primary care physicians can often refer to neuropsych clinics, but some hospitals will have more strict kind of referral streams where it needs to come from neurology or from psychiatry. So in the event that you are in a clinical system that needs a referral from neurology or psychiatry, you might want to ask your PCP to be connected with a specialist. And hopefully your PCP is good. And if you're getting memory problems, they would connect you with a specialist. I feel like most PCPs are pretty solid about connecting folks. But yeah, so I think it varies highly. In terms of studies at Emory that have this type of evaluation, there are some, it kind of varies again. For example, the Cognitive Empowerment Program, if you're a member here, you do get some sort of shorter evaluations as part of your baseline and sort of follow-up testing. You do some neuropsych testing with us, but it's not a clinical evaluation per se. Dr. Vickers or Dr. Goldstein can chime in if that is inaccurate, but that's my understanding is it's not meant to be diagnostic. It's more meant to kind of test your trajectory over time in relationship to the research study. Good questions though. Next slide, please. I think that you went forward, not backwards, I think, unless I duplicated the slide. Or sorry, other way, one more, there we go. So I talked about the clinical interview. Again, this is going to look, usually 15 minutes, 30 minutes to an hour. And the folks will ask you questions about your, kind of current cognitive problems, medical history, psychiatric history, things like that. Next slide. So then I mentioned again the cognitive testing piece. Again, I'll just re-emphasize what I already said. So some of the testing you'll do with the neuropsychologist. You might also work with the students or the trainee clinicians, as they're referred to. So like myself, I'm still, I'm toward the end of my training, but I'm completing my training in neuropsychology. So you might work with me if you, were to see our clinic. And then sometimes there are these people called psychometrists or psychometricians who will administer some tests. I kind of liken it to the idea of going to any sort of medical clinic where oftentimes you'll interact with like the nurse practitioner and like the scribe and the doctor. So there's all kinds of different people you'll see sometimes during an evaluation. I just saw another question in the chat, which I'll hold to the end because it's a little bit more related to a specific instance. But thank you for the question, Kathy. Can you go to the next slide, please? Okay. So when we get all this information from the neuropsych testing, what do we actually do with it as neuropsychologists or trainees working in the neuropsych field? Can you kind of hit the slides? Yeah, so one thing we do is we compare your score on testing against kind of what's called an estimated premorbid level of cognitive functioning. So some tests that we do are supposed to be, they're designed to be very resilient to brain changes. So for example, even, people with very advanced forms of dementia can typically do some specific tasks that we ask them to do. So those tests are kind of designed to estimate how do we think you were before whatever's happening to you now. So before you have Alzheimer's disease or before you had a stroke. So we try to get some estimate of how we think you're doing now versus before. It's not perfect, of course, but we try our best with that. We also, though, have this ability to compare your scores against what are referred to as normative data sets from people who are like you. So we're still continuing to expand our normative data sets for many groups, but typically for our cognitive tests, we're able to compare how you're doing against other individuals of a similar age with a similar educational background. Sometimes we have norms that differ between men and women because there are certain cognitive things that women and men tend to be a little bit stronger at, or vice versa. And then we have some norms available based off of race or ethnicity, or if you are immigrated to the United States from certain countries. Some countries have norms if you're like a Spanish speaker from a certain country, for example. So we want to compare kind of how we think you should be against other people of your similar demographic. And then sometimes you'll be referred, or you'll be sort of recommended at the conclusion of an evaluation to come back and kind of follow up with you over time. So the nice thing about that is if you get a neuropsychological evaluation and then you are asked to come back in 2 years for repeat testing to see how you're doing functionally, and if your cognitive, if your issues cognitively are staying the same or getting worse, we're able to compare you against the baseline of your scores from a couple of years ago. So I kind of like to compare, like this last piece, I kind of like to say, like when you get blood work, for example, for like your A1C levels for diabetes, you're kind of able to see, oh, if I'm doing more lifestyle intervention, did that help my A1C level? Similarly, if there are certain things we recommend to you to do, and that you're kind of implementing those, we're able to see a couple of years later if that's improving or not, your cognitive abilities. So, a question I got in the Q&A box is, what sort of information is shared with the person being evaluated, and if so, what types of steps are recommended? So I'm going to hold this question because I think it's going to be answered in the coming slides, because we do all of this to help you. So it's not just to make you do a bunch of cognitive tests that are challenging and make you feel frustrated. We want to provide you with practical information that's helpful to your healthcare and to your life. So I'm going to answer that question, but it's in the slides. Next slide, please. So to that note, actually, after the neuropsychological testing session is completed and you leave the evaluation, you hopefully go home and relax and take a nice nap or something to kind of decompress from the testing day, because it's a lot, taking your brain on that test drive, right? The neuropsychologist, and if anyone's working with them, like a trainee like myself, will write a report which goes into your medical record. So here at Emory, if you're seen here, if you're referred to us, we write a report which goes into the record that details the results of your testing, some of the information you share with us from the clinical interview and how that contextualizes the results, and also, our diagnostic impressions and recommendations. So it goes into, at minimum, people will write reports that go into the medical record. And if you have access to things like my chart or the patient portal, you'll be able to read that report. Oftentimes providers will schedule, or in some cases, providers might schedule feedback sessions over Zoom or phone, or sometimes in person, where you come back and talk to the provider about the results of testing, kind of what that means and what the recommendations are. And inside that neuropsych report, or during the feedback session, the providers will give you recommendations based off of what they think is going on with you, based off of all the factors of the testing session and the chart review. So that can include things like going back to your other physicians for further diagnostic workup, as your treating neurologist or psychiatrist might think is best. Sometimes we refer to other specialty providers. So it's pretty common, throughout life to experience anxiety and depression. And there are both medications that help with that, but also things like cognitive behavioral therapy and some evidence-based psychotherapies that are time limited, that we often refer people to try to pursue psychotherapy sometimes. And then commonly too, we recommend and kind of reinforce the idea that a lot of your PCPs and neurologists and psychiatrists will say, which are lifestyle interventions. So following certain diets that might be helpful or more nutritious, or increasing physical activity if you're inactive right now. Those are some kind of examples of common recommendations you might see. But of course, the recommendations will vary based off the diagnosis and everything like that. Can we go to the next slide, please? So if you're referred, or if your loved one's referred for a neuropsychological evaluation, how can you prepare? Next slide. If you just want to, yeah, you can just go ahead and fill out. There we go. So generally speaking, I mean, most of the time, hopefully your neuropsychologist and their, administrative support team would be in touch with you in advance about the testing session and sort of the what you should do. Again, I think it's always good, and I always try to convey to people I see in advance that they're going to be spending a large chunk of their day with me. So generally, it's good to follow your normal routine. So you don't really do anything else, don't do anything different than you normally would do. Unless you're told otherwise, you always should be taking your medications as you normally would be. Try to get a good night's sleep if you can, and don't, it's generally advisable not to consume illicit substances in excess, perhaps, prior to the evaluation. I think like one example of this would be, if you showed up to get an evaluation and you were intoxicated, it would be very difficult to say, are the cognitive problems due to something like Alzheimer's disease or a neurological disorder, or what was due to being intoxicated. If you can go to the next slide. I think there's another, yeah. So again, on the day of the evaluation, kind of like a lot of other medical visits, it's always good to try to arrive a little bit early if you can. I know, especially in Atlanta, as I'm learning from coming from Boston, traffic is very unpredictable here. So it's always good to try to arrive early, because that helps you and the team that you're, the neuropsychologist you're seeing get started on time and early sometimes with your appointment, which is good, I think, especially for these long evaluations. It's always a good idea, I think, to bring, this is something to kind of help empower you with your healthcare. It's always a good idea to help bring things like notes about your medical history, any medications you might need to take during the day. Like, for example, if you need to take certain medications at 10 o'clock and noon and 2, bring your medications with you. It's good to bring a snack and some water. Sometimes, for example, like Emory Brain Health Center has a cafeteria where you can buy lunch. Again, these evaluations can last kind of long, so it's good to come prepared with what you might need to kind of get through a long period of time. Importantly, if you need glasses to read or hearing aids to hear, be sure to bring them and to use them, because it's not going to do much good to try to get tested for memory and thinking skills if you must have hearing aids and you can't hear because you don't have them. It's always good too. I just, in general, with like neuropsychologists or other providers, if you have concerns about, sensory things like you're not able to hear as well, to maybe call ahead with the office staff and discuss that. Because usually that helps us be aware of how we can best help you in advance. If it's possible, if you have a care partner, like a spouse or a family member or a close friend who knows you well and someone you see regularly, it can be helpful, not only to have them, come with you to the interview to help drive you there if you need that help, but also it can be helpful to have them there so they can, with your permission, of course, sit in on the interview piece and provide some sort of secondary approach, because sometimes it can be hard with certain memory and thinking problems for the person with those problems to actually have good insight to everything that's going on. Like, you can't remember what you're forgetting if you can't remember things well. So sometimes it can be helpful to have someone else there to provide some, again, with your permission, provide some additional information. They won't be sitting in on the testing session. Like they can't, I always hear people say like, oh, like my wife or my husband, they're the one who I ask if I need to remember something. So they're not going to be your memory aid during the testing part, but they can kind of help with some of the background and your history. And of course, like other medical appointments, it's always good to prepare any questions you might have for the neuropsychologist in advance too. Next slide. And you can go ahead and just, yeah. So a few do's and don'ts, or just a couple do's and don'ts for neuropsych evaluations. Again, always, you'll be told this, but just try to do your best on testing. Even when it feels hard, it's important to notice, again, some of the tests are going to feel easy. Other ones are going to be hard. And the tests are designed that way to try to pick up what are your areas of cognitive strength and cognitive weakness, because we all have them, whether you're somebody who has MCI or somebody who's, a young person who's cognitively normal. We all have strengths and weaknesses, and the tests are designed to kind of pick up what's going on with this. And I would always encourage you to try to plan nice relaxation after the evaluation if your schedule allows. I know a lot of people have to work and it's challenging, but I don't know. I would not want to personally go back to work after taking my brain for a test drive for like 5 hours if I can avoid it. So if you can take a day off, from work, if you have to work, it's always good to plan some rest into that if possible. It's not always possible, but it's good to try. I would say don't try to study for the evaluation. So we want to see how you're doing on a normal day. So it's not like, taking an exam in college or high school where you want to study how to do calculus or something. We're just trying to see how are you doing normally with your cognitive abilities. I see a question from Bob in the chat. Is testing available for non-English speakers? So yes, I would say if you or your loved one speaks a certain language, I would encourage you, if you're referred to a neuropsychological evaluation, to discuss that as early as possible with the provider, because there are some providers who speak multiple languages, and then if they don't speak multiple languages, they might know somebody who speaks that language and could be the more appropriate referral source, or they'd be able to help secure, in some instances, like in hospitals, an interpreter for the evaluation. So it's good to be in touch in advance. We don't think we have tests for every language that exists, because there are many different languages, but it's always good to be proactive in that conversation. So nice, good question, Bob. Okay, next slide, please. Oh, okay, so we're at the end. I forgot that we're at the end of this presentation because I previously had a little summary slide. But just to kind of, wrap up, we had talked about kind of what a neuropsychologist is, what neuropsychology is, how we differ from psychiatrists and neurologists, and sort of what to expect and how to prepare for these evaluations. So at this point, I'll welcome any questions. My email's here on the screen too. I want to say it was a real pleasure to chat with all of you today and to hear or to be part of empowering you with your healthcare in this regard. Because again, I think neuropsychology is sort of an obscure discipline that people may or may not have much experience with, but if you have memory or thinking problems, you'll often interface with us. So again, I want to thank the CEP and especially Dr. Vickers and Goldstein and Dr. Sauerman for their feedback on this. And I'll take any questions at this time. So I'm seeing there's a couple of questions here. I'll just say, I think to Kathy's question, to talk specifically to your provider, to your primary care neurologist about that. Because again, without knowing without your loved one being my client or patient, I don't want to make medical advice, but circling back with your care team is the best way to kind of think about, is neuropsych testing appropriate for me or not. I think I hit some of these questions already. Bob asked a question earlier: how important are primary care and another specialist medical providers to dealing with MCI? So I think it's always good to, typically your first point of contact, right, will always be like your primary care doctor, who will connect you with neurology or psychiatry. So neuropsychologists are part of this piece of the puzzle. So some providers will refer you to us, others won't. It kind of depends. I think it can be helpful, certainly, to get, if you have good insurance and you're able to afford it, to get this kind of test drive picture of your brain, the neuropsych testing. So it can vary. It looks like another person asks if, excuse me, if Medicare can pay for this type of evaluation. So I think Medicare commonly does pay for it. I think the main thing is just, contacting your specific insurance in advance, or to have some sort of coverage with that. Some providers may or may not take Medicare too. It sort of depends on providers and what the institution they work in. But I would say generally, a lot of times Medicare pays for these, or at least pays some of it. Let's see. Again, I think for specific questions, I would again encourage you to speak directly with your medical or neurological providers, again, because I love speaking to all of you, but I don't know you well in your individual circumstances. So I think, talking to them about your concerns in general, a lot of the advice I had today about, bringing notes, talking to your providers frequently, that can be applied to other settings.
And I love what you said, Josh, earlier about a care team, that it really does take a team. We talk about this a lot at CEP. It's like the more information that you get, the more empowered that you can be to make these choices and to really know your strengths.
Mhm.
And to be able to also know the places that you would like to put in some support for the places that are maybe not as strong as they used to be. And that's what's so great about the information of being able to go through all of these individual things, is that to know the strengths and know where things are. And the suggestions that you offered were amazing. These are things that come up at CEP all the time. Things that you may not think about, how long these tests take. It's a long time, and being prepared with things like snacks. And I can't tell you how often folks come in for that long day and think, oh, I wish I'd have my hearing aids. It happens all the time. And so just that little reminder of the glasses, the hearing aids, the things that really do make you think about, when you're performing at processing information your best with a full night's rest. And that was phenomenal. I think especially the recommendation about bringing the care partner with you. We see all the time, more often than not, especially because it is a full day, having that support there with you is one of the things that can also be sort of an anchor in the room for you during that. I think most of you who are on the call who have been through those tests can be a witness to the fact that, after 4 or 5 hours, maybe sometimes, of answering questions, just having someone to be in the room with you can be something that is calming in and of itself. So those were phenomenal suggestions. Especially, I loved you said not to go to work afterwards. It's like,
if you can avoid it. I know not everyone can, and I know we don't unfortunately have a lot of, in this country, unfortunately, like very good protections around sick days sometimes, but I don't know. I think I do neuropsychological evaluations with people a lot. So the idea of going to get one myself and then going to do one, that would just totally hurt my brain.
and the question came up too, like, when we're thinking about these tests and planning for these tests, one of the questions that came up is, how early is too early? When is the time that we should start tracking these changes? And I'm curious about your perspective on that for one of the questions that came in from Rosemary.
Yeah, that's a really good question. And thanks for flagging that for me. So I think, my opinion in general with all healthcare things is that it's never too early to have a conversation. I mean, there is such a thing as hypochondriasis, or being a hypochondriac and being worried about medical things maybe in an unhelpful way. But I think if you're starting to notice, for example, cognitive changes that don't seem quite right for you, or things that you think, oh, my friend of a similar age doesn't seem to have this problem, that's the time to bring it up to your PCP and to maybe, I don't know how frequently people follow up with their PCPs, if it's every 6 months or a year, but just because you have an evaluation with your doctor scheduled for a year from now, if you're noticing things that seem problematic to you, that can be a flag to call your primary care doctor and talk to them and say, hey, I'm noticing this. Can you get me in, or can you connect me with neurology or psychiatry who might refer us to neuropsych? There was a question just to that end really briefly. I think some PCPs will refer directly to neuropsychologists. I think the issue, I'm really glad to be here today and helping provide some education around neuropsych to you all, but I think because there's so many specialties, and again, I think neuropsych is a little bit obscure, there are some PCPs who may not really know what neuropsych is or what we do. And that doesn't necessarily mean they're a bad primary care doctor or anything like that. But there's this sort of double-edged sword of helping educate people who might be coming in for neuropsych evaluations, like patients from the community, but also educating providers. I will say I feel like most neurologists and psychiatrists know what we do, because we're kind of, again, linked kind of in a little trio that you'll commonly see. But in the event, I think you just saw, I saw your chat about the CEP program. But I say in the event that your primary care doctor doesn't know what neuropsych is, you can say, hey, I would encourage you at that point to connect them with neurology, and then kind of go from there. And it'll vary, I think, depending on your hospital network and kind of your insurance, whether or not you can just be referred straight to a neuropsychologist, or if you kind of need to be triaged along the way. Because again, I don't necessarily think it's a bad thing to get a neuropsych eval and then for us to say you're cognitively normal and doing well. Like, I always love those evaluations as a trainee provider, because it makes my day to tell people they're doing well versus having problems. But it's going to be a long evaluation to kind of figure out you're doing well. So if there are other steps along the way, like neurology or psychiatry, that can kind of help triage some of the concern, that can be helpful too.
Yeah, definitely. Again, part of that care team.
Yeah.
One of the questions that came up is, how does dyslexia play a role in cognitive testing? Is that something that would affect the scores? What do you think, Josh?
I mean, so I think dyslexia is a specific type of, it's called a specific learning disorder. That's something that's neurodevelopmental. So commonly people with dyslexia, they will have this symptoms of dyslexia, like issues reading and sometimes comprehension from reading, beginning as early as childhood. So these are things. So for example, if you have a history of dyslexia or a loved one who's getting testing, you would want to tell your neuropsychologist and your other providers about that history, right? Because if I'm doing some tests where, let's just say hypothetically, I want you to read something and then tell me about what you read later on, if you're dyslexic, I might accidentally interpret that as a memory problem if you're forgetting things, but maybe in the first place you're having difficulty reading, if that makes sense. And trained neuropsychologists will, or really savvy neuropsychologists will understand that difference. And there are many tests that we do that kind of suss that out. But certainly if you have some development, and actually especially for children and adults, neuropsych testing often is kind of part of the process to diagnose dyslexia many times. But if you have a history of dyslexia, be sure to tell your provider.
And I love that too. It's like, it reinforces what you said earlier about getting more specific about what the issues are that are happening, that all of these tests can, especially if you have maybe things that are happening at the same time, dual diagnoses and things like that, having these neuropsych tests can really kind of help you flesh out, what is happening from what part of the brain is being affected. And I think that's one of the good kind of, reminders to kind of take that time to really know what is it because of my dyslexia, or am I actually having some memory issues? And those can really make big differences in the recommendations that we would say for you. I mean, that's one of the best things, is just really kind of narrowing down what are the lifestyle interventions that I can implement in my life that are neuroprotective, that really make the most to sustain the memory that I have now. And a lot of times when we're talking about memory loss, it's really keeping what we have now as long as we can that we're talking about. And what the research shows is that the interventions really do work. that those recommendations really do work, and knowing what part of your brain is affected can really sort of, what should I be spending my time on? Is it the different brain exercises? Is it the more of the processing of different information in different orders? What are tools that I could be empowered with, like things we teach at CEP, like the calendar and things like that? So I'm so thankful, Josh, to have you a part of the CEP team. It's really good to be able to bring up this term neuropsychology, which maybe for our parents or grandparents, memory loss wasn't an option or wasn't a term that was being tossed around in the doctor's office at one point. And now it's really good to know, what are some of the solutions that are available to me? What does my insurance cover? Things like that, to be able to talk to the right people and get the right support. So thank you guys all for coming and attending and checking out Josh's talk this week. All of our education sessions are recorded and posted to our YouTube channel that I've shared a link for in the chat. If you want to check out those links there, we've got weekly newsletters. You can find the PowerPoint from this week in our Google Drive that's available in the chat. So thank you guys all for coming and attending this week. We'll offer the same programming next week, so be sure to tune in live. Josh, welcome to the CEP team. It's really good to have you here to really kind of encourage everybody to use the resources they have, to get the tests in that they need, and to really kind of be as neuroprotective as we can in the chapter ahead. So thank you so much, Josh.
You bet. Thanks so much for the invitation. And it was nice meeting all of you. Have a good rest of your day. Bye-bye.